Hey guys, it's Joel, and I wanted to talk to you about something that's called brain spotting. I'm not sure if you've ever heard of it. It's not as well known as a lot of other treatment modalities that have been around a little bit longer, but the research on it that is out there is really good. It's newer, so there's not a ton of research. But what interested me in it the most wasn't research, because I think sometimes research can be done in a way to protect someone's bottom line, or it can be done in a way to make the findings so objective that they're not really telling you what's going on as much. So the research on it for PTSD and trauma to treat that are really good numbers. There's not a ton of research, but it's good. But more importantly than that, to me, was that every single person who I had been encountered as a patient or as a clinician who had used it or tried it, or both, were over the moon about it, and were switching their practice to use it. So that was kind of a better signal to me that this was a good thing that I needed to look at. And I got trained in it about a month and a half ago. I've had a really amazing results with almost everybody who's tried it. I haven't had anyone that hated it and said, "Oh, that's terrible. I don't want to do that again." Some people that don't have real severe trauma were maybe like, "Well, that's interesting. That kind of relaxed me, or that felt different." But the people who love it and feel like they notice a huge difference really quickly. So the way that brain spotting works, it's a treatment that was developed for trauma and PTSD. It also works really well for kind of attachment dysregulation, if there's like neglect or abuse or just inconsistency in childhood. But even if you don't have that going on, it works really well just for kind of anxieties or phobias, and that kind of inability to relax and calm down, feeling worked up all the time, feeling stressed, that sometimes life just rewires our brain to live in, even if we don't have trauma. And it's similar to EMDR in that it involves eye movement, but it's a lot simpler than EMDR, and I think it processes a lot deeper. My experience with EMDR, that's an eye movement therapy where you move your eyes back and forth. If you're not familiar with it, it turns on the kind of creative part of your brain. With during trauma, you're just reliving on that logical, data-driven side, so you understand the trauma in a very concrete way, and you can't really get outside of it. EMDR kind of turns on that creative, perspective shifting metaphor brain that all of a sudden you can say, okay, well, maybe this wasn't really my fault. That never occurred to me. I felt like it was my fault, but now I kind of feel that it wasn't. But EMDR like that is still very narrative. When you're doing that with patients, they're kind of going through a narrative and having a different narrative understanding. So, I mean, that to say it's very thinky. You're still sort of thinking about it. Brain spotting does a lot more of the feelings that you don't notice in your body. It kind of restores that connection between your mind and your body, where you're really worked up, you're really keyed up, but you don't even know that a lot of the time. It makes that more recognizable to you. And so my experience, because in order to do the treatment, the training for brain spotting, you have to have it done to you. So my experience with it, which I had kind of said this to patients who are having a trouble explaining what their experience was, because it can be kind of psychedelic and weird in that you can't really describe what's happening. And when I put it this way, people were very much into like, yes, like that. Exactly, that's what happened. I didn't have words for it, but so my experience with it, which is still hard for me to explain, was that I kind of had my thinky personality brain going. That was like, what is this? I don't feel good. I don't like this eye position. This is making me uncomfortable. Why is that? And then I just felt that turn off. And I went to a very deep kind of body brain level where I didn't have words really. Like they asked me some questions during the treatment and I couldn't really talk. And I just felt muscles in my back where I keep a lot of tension in the back of my neck, in my mid back, around my shoulders, just kind of opening and closing. And I wasn't trying to do that. And I was like, why is that? And then I realized I had control over it. And then my whole back relaxed. And then I just kind of sank down into this deep emotion. It's very base brain, kind of basal ganglia, body brain part that it's activating in your brain when you do brain spotting. And it felt like I was just feeling this kind of deep emotion of maybe sadness, or just kind of a sadness that there were things in life that were bad and things that I can't really describe the emotion perfectly. But what I was feeling was that I was always aware of this. I was always feeling it, but I was kind of running from it and I'm looking from it. And it was underneath a lot of my obsessive behavior. It was underneath a lot of my need to be more than I can be, or my fear about life. and that I was just feeling it in that moment, but it wasn't that I was feeling bad, it was that I was becoming aware that I always was feeling bad, and I just wasn't aware of that. And it was very, very strange experience. It made me feel a lot more whole and a lot better. But in short, I felt my cognitive, thinky personality brain turn off. Then I felt where I store the kind of bad, negative anxiety emotions in my body. I became aware of where that was, and then I felt this deep, deep feeling that was kind of profound. And then over the next couple of days, because with brain spotting, unlike EMDR, most of the treatment, the processing of it happens outside of the room. Because I'm just opening the box with brain spotting in the room, and then your brain is kind of figuring out, what do I do with all this stuff that I now have access to? I used to say, well, I can't think about that, I'll shut down before I get there. But I wasn't aware that I was doing that. I just was shutting down before I could think about it. But after brain spotting for about a week, you kind of start to have things pop up of, oh, that's why I felt that way, or that's the time when that emotion was there. And I kind of remembered stuff from my childhood, and it was interesting. You also have very intense dreams. I mean, I had kind of wild dreams for a week, and some of the people from the training who were my friends called and said, are you having weird dreams? And I was like, no, whoa, okay, yeah, there were wolves walking around my house, and I was trying to scare them off, and I just remembered this kind of deep miasma of very mythy, symbolic imagery that had gone on all night long. So it definitely does something. And afterwards, there was a permanent change in how much anxiety I store. When I get upset, I'll realize my shoulders are getting tense, but I never realized that before. I would maybe be tight at the end of the day, but I never knew that that was happening. So there was a permanent change for me, and I don't have PTSD. So, I'm not coming at it from a place where I was totally decompensated or having a real severe symptom. But I have done brain spotting with a lot of people that do have PTSD, and there's been an enormous improvement. So I'm a huge fan of it. I generally don't encounter a lot of trainings where I'm like, oh, I need to do the next level and then get the certification and all that, because I feel like I kind of understand it and I can use it from the beginning trainings. But brain spotting's different. I'm gonna take a week off in the future to go to the second part of the training because I am so interested in it. So if that's something that sounds like it would be something you're into, give me a call. I'd love to be able to do it with you. I've also got a list of other people that do it in the Birmingham area. If you don't want to see me, or you'd be more comfortable with a woman or somebody older, younger, whatever, just give me a call and I'm happy to refer you to them. But it's an interesting treatment methodology. If you are a provider, I would look at getting trained in it. If you're a patient, I would look at trying it out. And the best part is that it really only takes about 40 minutes to do. And if it doesn't work, then you just stop. So you're not out, months of treatment. You really can do a full brain spotting session with some pretty neat results in about 30 minutes. So it's worth looking at. I hope that you guys are having a good Saturday, and I will talk to you soon. Take care. Bye.